Yep. Great. Okay, so we're going to talk a little bit, as Claire said, about what we did for our evaluation. This is our essay question, which we were set by the delivery partners quite a long time ago now. And so you can read this at your leisure, but it boils down to, so what difference has it made? And I'll say now that although this refers to England, Wales, Northern Ireland and Scotland, what we've done in this part of the evaluation is focused on the English programme and the 10 sites there. Scotland, I know, are working on evaluating their programme, and our report refers to both, but we're going to focus here on the English sites. And in order to do that, we boiled things down to look at 3 rather more specific questions that we could get our teeth into, and we'll talk about those in turn. Firstly, what interventions have been effective that you've done locally? Secondly, what's been the impact of the programme in supporting you to do what you've done? And thirdly, has this actually built on what's gone on in the past? And these are the various chunks of information that we've used to look at each of those. You in the room have contributed to a lot of these, in fact most of these, so you've submitted a case study or one or more case studies about what you've done. We asked you to submit some data around headline process measures, and we'll talk a little bit about the joys and sorrows of those when we get a bit later on. We've sent you questionnaires to ask you about firstly what you've done and what it's felt like for you implementing your local plans, and secondly around what the relationships have been like within the community of practice, and we'll return to that again because I think that picks up on some of the points that have already been made this morning. And lastly, we've sort of sat with wet towels around our heads looking at desk research and going back to see where things have come from and where things might go in the future. So firstly then, what interventions have been effective? And I think the first thing to say, well, it's early days, and the elevator pitches that you've made this morning and the information that you've shared has sort of reinforced that there's quite a lot of things here that are at early stages of implementation. It's not surprising. You're at the end of a 2-year programme. There's a long way to go from that. It does mean that there's some limitation on the evidence that we've got to look at around what the impact's been, in most cases, because you haven't had time yet. But there is some variability in measurement, and we'll return to this at the end around some of the issues with measurement across the system as a whole. The other issue is that because the programme wasn't saying, here's a set of things you've got to do, go away and do it. It was saying, think about your priorities, think about what you need to do, put your own plan together, and we will support you to do that. That everybody's quite rightly gone about that in a different way, with a different set of interventions. We're comparing apples and oranges if what we're trying to do is to say, well, let's see whether it worked better in site A than in site B. We can't do that, so we're looking at a different way of measuring. But we do have some initial indications of what's happening. I was asked to make our slides interesting. That's a bit of a challenge when you're talking about evaluation. All of these things that are popping up are the things that you've told us about that are happening out there and which you've reported to us in the case studies. It'll scroll on very slowly, but so I'll just do that and say there's an awful lot in there. And our report has made reference to many of the things that we've learnt from you about what's going on. We haven't looked at them in detail. What we've looked at them to do is to say, well, what does that tell us about how the programme has supported you? If you're at the back, you probably can't see this, but this is just to say that as we know, there are 4 programme themes within building on the best as a whole: shared decision making, pain and symptom management, outpatients and handover. The grey column is what you said you were going to do, and the other 3 columns just prove that over time, actually, quite a lot of you didn't do that at all. You moved. Some of you did things that you hadn't originally planned to do. Some of you were moved into different areas. Some of you, I think, probably did what you were planning to do, but it was sort of more relevant to one of the other themes than the one you... So that's fine. It's sort of proving that what the programme set out to do, which was to give you space to develop in the way that made sense to you, is in fact what happened. But we have looked at that and sort of done a little check exercise against sort of which of the themes have been most active, shall we say. The other way we've gone about looking at things, and this is partly due to our where we're coming from as an organisation, is we're interested in how the relationships in the system work and what impact the work that you've done has had on some of those relationships. And again, that green arrow is saying that some of the work you've done has worked on the relationship between the palliative end-of-life care team and patients and carers, some on the relationship within the palliative team itself, some between the palliative team and clinicians, professionals in other specialties or parts of the care system, and you've heard a bit about that already, that this is about moving outside the boundaries of the palliative care family into the extended family of acute care. And the one at the bottom is there are some things that have been operating on the relationship between the palliative care team and the management of the organisation as a whole. And so we wanted to look at, if you like, where the heat was within the programme, not just by which themes you were working on, but actually where within the system it hit. And so that's what this is doing. This is in our report, and you'll get a copy of the slides. This is our heat map, and just turning everything into a learning experience. I have learnt how to do a map where the size of the blob is proportionate to the number within it. So the two big blobs here are the bits of the matrix where most of the work has been going on. And this is about communication on handover and shared decision making. And this is about the relationship with other clinicians, specialties, wards, etc. So what you've been telling us already today around this is about making palliative end-of-life care part of the work of the whole hospital, is borne out by what we're seeing here in terms of actually once we start to tot up in a very in a systematic way what everybody's been doing across the 10 sites, that's just demonstrating that, yeah, that is what it's been about. It's been about taking palliative end-of-life care sensibility outside the specialty. So in terms of interventions that have been effective, it's early days. We've got limited evidence at this point, although we do have good evidence from some of the sites that we've already heard of around, the increase in processes, the increase in recording of information, which is critical, and some evidence about the impact on the culture and the practice in the extended family. We think you've got a lot more to learn in the longer term. And we think that there's an excellent case for returning to evaluate what's going on out there in the longer term. That's it for question 1. I'm going to hand over at this point to Heather to talk about question 2.
Thank you.
Again.
Hi. Just get this the right way around. Okay, so the question we're going to look at now, what impact has the programme had on the adoption of the interventions? And we're going to look, you answered that question in an impact survey, and also we did some follow-up interviews with site leads. And then we're thinking about the capability, capacity and resilience of staff to carry out that activity. We used a proxy measure for that, which was the relational value assessment, which we'll come on to talk about in a moment. So the programme impact survey, you don't need to know all the details, but we looked at it, we were looking at 3 different levels of change. So what impact has the programme had on your design and planning of the work that you then go ahead and do? What impact has it on implementing those changes? And what impact has the programme had on embedding those changes? And we also asked, overall, what impact do you think the Building on the Best programme has had for you? Within each of those stages of change, we were looking to see whether, where the impact was. Was it on generating new ideas and techniques? Was it on helping support you as an individual to be part of that process? and to add to the learning that was going on there? Was it enabling you as a local team to work together more effectively? Or was it something that came out of the community of practice that helped you in each of those stages of change? That's just a quick summary of responses. We did have, as I put up on the slide, there were 18 responses, 3 of which was from Scotland, but as you've heard already, they've not really featured in the overall evaluation here. So we looked at 15 responses, and all 10 sites were represented here. So you can see that for 8 out of 10 of the sites, the England sites, they felt that the programme had impacted at the stage of design and planning, 6 at implementation, 4 at the embedding stage, and 7 of the 10 sites said generally the programme had had an impact on what you're doing in end-of-life care, which is very positive. So then we went to think, well, what is it that's happening here? And where someone had given a low score for any of those factors, we asked for a comment so we could understand where it hadn't really impacted very much. Why was that? And as you can see in planning, it was about new techniques. It was about giving confidence in using the quality, the QI methodology for planning, including measurement. I think for some of the sites were very, very au fait with QI methodology already, but there were others where this was new, this was quite challenging, and there was some confidence building in using that methodology. There was shared learning, which has come out again and again throughout the evaluation. There was opportunity for cross-fertilisation of ideas, which is really very valuable. Where there were low ratings, it was more about what was happening back in your local site than what was happening in the programme itself. So we're looking at quality improvement consistency. There wasn't a quality improvement lead who was really involved in what you were doing. But there was also some comments about wanting the central team, the main programme team, to be a bit more directive, and we'll see that comes up in other places as well. For implementation of change, particularly it was helpful in terms of personal support to contribute to the implementation and opportunities for shared learning. What's happening in another site? What happened when they implemented a similar change? What can we learn from that? And again, the low ratings reflecting variation in local support. On some sites, there was actually a designated project manager. In others, there wasn't, and that made a big difference in terms of how you can implement the changes that you've been designing. Embedding, again, shared learning and reflection. This is the lowest, as you can see. Only 4 out of 10 sites felt there'd been an impact there. You'd expect that at this stage because of the project timescale. It is very early days. But some of the teams were saying that they had already started to learn from what other people were saying about embedding, and were beginning to reflect on what they thought they might do, but now that might be changing. Overall, there were new techniques and ideas, personal support and shared learning, and the lowest ratings overall were enabling more effective team working. That's not to say that there wasn't good team working anyway. In fact, there might have been really good internal team working anyway. We followed the impact survey up with site interviews, where we spoke to site leads from 5 different sites. We chose the 2 highest that came out of the impact survey, the 2 lowest, and 1 in the middle. So we could have a fair reflection on a verbal report of what's happening on your site in terms of project impact. As you can expect, the feedback aligned with the survey responses. We don't know if those people we interviewed actually filled in the survey. It was all done anonymously, so we don't know about that. And you can see what came out of that. We actually have only included 4 out of the 5 responses in our evaluation because one of them was Scotland. We also asked a question about the quality improvement methodology. How confident do you feel? Do you think that the programme has had an impact in your using QI methodology here, and would you be prepared to use it elsewhere? And we asked about shared learning, and we got lots of feedback about that there had been a lot of shared learning. And we also asked about barriers to change. What came back from that was the normal things you would expect, like financial restraint, other priorities, winter pressures, HR change, staffing changes, personnel changes. There was nothing new in that, but things that you would see in any change program. One of the things that came up in terms of barriers to change was webinar access. So being able to access and be part of the webinars for the community of practice, which were a very important part of what the Building on the Best programme was doing in order to bring people together and to enable shared learnings, and we'll come back to that a bit later. But as you can see, the second bullet point, one of the real key impacts has been the community of practice that has enabled teams from different acute trusts to actually communicate with one another, to share learning, just to share, this is how it is for us, how is it for you? That's been really a vital part of this programme and led to a lot of change. So to look at the capability, capacity and resilience of staff, we use the relational value tool, which is an approach developed by WSP, which looks at relationships in between. So we're not looking at connectivity or networking, we're looking at what do we build between us when we work together in any system or in any way. We did this at 2 points in the programme. We did it in June last year. We did it again in March this year. We did it looking at relationships within the community of practice, although our original intent had been to do it within your teams as well, to see whether working together on this programme improved relationships within your team, but we didn't have the capacity to do that really in the end. We did it after the first survey. There were 2 things that came back. One was that there was a real issue with technology, so that people felt the relationships were impacted by the fact that actually you couldn't be part of the webinars, and you couldn't always be part of the face-to-face cluster meetings or when everybody got together, because it was in London. There were a few issues like that. The other thing that came out of it was about system integrity, about everybody pulling together and working together. In response to that, after the first survey, some changes were made. There was a move to the Echo and Zoom technology. And there was also the central team actually made real efforts to make sure that all the stakeholders were included in all information sharing. So action was taken on that. And at the second point of the survey, the relational value survey, there was an improvement in the overall relationships. And generally speaking, there are good relationships built, which were seen to be really conducive to the change programme that you were implementing. And as we all know, there's lots of evidence out there that says where there are good relationships, there are good outcomes. Where there are poor relationships, outcomes aren't so good. So the summary of the question 2 part of the evaluation, the programme is seen by participants as having a positive impact on improvement, more so at this stage on planning and implementation than on embedding change, and the community of practice is especially valued.
Okay, so I think I'm back on. Yep. So. Third question then was about, has this built on what's gone on before, and in particularly the Transform programme, which many of you will have been involved in. And the quick answer is yes, but not in the way that I'd anticipated when we embarked on this, that actually Building on Their Best hasn't been about doing different things, it's been about doing tried and tested things in new ways and in new places. So it's back to this point about we've got the Transform building blocks, which you'll all be familiar with. They're quite simple things around involving people, around sharing information, shared records. But actually what's different about Building on the Best, as you saw from the heat map, is that it's moved out into the wider community. So we've got evidence of innovation in how you're doing things rather than in what the changes are that you're making. So, just before we finish, inevitably when you do this stuff you get other messages that weren't part of the essay questions. So it's exam season, you know the bits that you sort of scribble in the margin that you wish you could include and work in. Well, we're going to work them in anyway. So here are the rest of the headline messages from us to you based on what we've learned. Measurement. Okay, so the question of measurement comes up time and time again. And when we embarked on this, when we first started to talk to people in each site around what they wanted out of an evaluation or what they wanted out of the programme, people said to us, we really need to be able to build the evidence that we need to go to our trust boards, go to our management teams and say we are worth investing in. That's the sort of evidence you need to demonstrate that what you've done has made a difference. Well, we've reached the end, and some people are doing it really brilliantly, but it has to be said there are some gaps. So our message for the future, if you like, is this should not be an optional activity. And a colleague from Birmingham said, you don't just, you need to think about what you're measuring rather than just measuring the things you can measure. Absolutely. You need numbers, but you also need stories, and they can't exist properly one without the other. I would say start simple and build from there. If you're not doing anything, it doesn't mean you have to leap straight into multivariate analysis with run charts and all that sort of thing. We have done quite a lot of projects where the best measurement has been gathered by people wandering around with post-it notes and counting things, but they're counting the right things, and they're counting them at the beginning as well as at the end, so that actually you've got a baseline. You can tell the story about what the impact's been right from the beginning, and sometimes good enough really is good enough. It doesn't have to be dressed up with lots of techie stuff. It's about being able to tell that story clearly and with some very simple to understand numbers that can back up your story. So looking ahead, there is absolutely nothing wrong with the tried and tested. That's what this programme's been about. It's been about innovating where you're implementing the tried and tested and who you're working with as well as what. And on the subject of moving out there and working with other colleagues, and I think there's been some brilliant examples of this from Southport and others, actually people are really willing to work with you. Not only that, they're actually knocking at the door asking to work with you, because out there, knowledge and confidence about how to work on end-of-life care, palliative care issues, how to communicate with patients and carers in the right kind of way, you've got really valuable information that people want. That's not always the case when you're trying to implement change. There is still lots to do. You're the best, and you found lots of other places to do these things. So, imagine what it's like if you're in a site where you're not the best, and actually you've got a lower base to start from, but there are still big wins out there. I've learned about the difference between being a change platform and a change programme. A change programme is where you march in, they issue you with the how to do it guide and say, right, go away and do it, and we'll make you fill in 5 pages of progress reports. And if you're not good enough, then something horrible unspecified but horrible will happen to you. A change platform is what you lot are. So it's getting together in the community of practice and in the fantastic phrase, and I don't know whether it's invented by Building on the Best, but I suspect not, pinch with pride. And we've got great examples of people pinching with pride in all sorts of directions in this room, and long may it continue. I haven't been quite knocking around the NHS for 70 years, but it feels like that sometimes. And every transformation programme you ever embark on, you have a slide that says, what were the barriers to change? And they say it's technology, it was time, it was resources, it was management support. So you know they're going to be there to start with. How about you know they're going to be there and plan accordingly and plan them in from the beginning? You might not be able to do that overtly if some of it is about management support and lack of support from higher up the organisation, but you and your team know that that's going to be an issue. So just kind of take that as read and carry on. So that's our essay report. And thank you very much. And I don't know where we are on time, but we're happy to take some questions if you've got them.